really the principal utility of this was to utilize it for sealing the superior thyroid artery. So in the past, we would dissect out the superior pole, we would isolate the superior thyroid artery, we would need to get clamps above and below the area in which we intended to divide the artery, and then we would need to apply sutures to that artery, typically a 2/0 silk stitch is what I utilized in my operating room. When I started using the Focus and the energy product, which is literally almost half of my practice ago from a time perspective, those maneuvers became so much more simple. So even though there is a single artery, there is a very rich lattice of both arterial and venous vessels around the superior pole. And as you dissect them, you can actually fracture those small vessels. And when you fracture those small vessels, as you try to achieve hemostasis, and again, at that time in my hands, it was mainly utilizing a bipolar cautery, you potentially would put the vasculature at risk, and you would also put the superior laryngeal nerve at risk. And so with time, as I developed a facility with the instrument, I found that I was able to isolate the superior pole, isolate the superior thyroid artery with a single fell swoop, divide that artery, not have to put any sutures on it, and really, in my hands, reduce the risk of injury to the superior laryngeal nerve. It really is something that can help my surgical colleagues to be able to provide just that incremental little improvement in patient care. Because, when you live in a patient-centric universe, every little thing we do to patients really does make a difference. That multifunctionality of being able to both dissect as well as cauterize. And there's even times where you can use the harmonic like a bipolar, where you just lightly bring it together, apply energy, and manage what I would call petechial bleeding rather than larger vessels, where it's no longer necessary to pick up and put down another instrument. So I think all of that, as it evolved in my hands, really became a much more efficient ecosystem in the operating room. In terms of my own personal views of it, we're far more efficient. There's less anxiety-provoking moments during surgery. I no longer feel like I have the amount of bleeding around the superior pole that I used to have, which really makes my job a lot easier. Similarly, with patients, the fact that we're able to manage vessels, that we don't have to intensify our efforts to obtain hemostasis. And as I've alluded to, both reducing the risk of injury to the recurrent laryngeal nerve, the superior laryngeal nerve, and the parathyroid glands, getting patients off the operating table, 5, 10, 15 minutes quicker. I think all of those things make a huge difference in terms of patient outcomes. So it's really been a very significant augmentation to my surgical practice.